So quickly we will discuss about the concept of sepsis. Sorry, yeah. So whenever we see a patient in the ER, so definitely, for example, there is a patient came with fever and low BP, increased heart rate, cold clammy skins. So we will suspect the sepsis. So what is sepsis? Sepsis is nothing but blood infection. So in order to treat a sepsis patient, we have to go in the order. So there is a certain order. So before treating a sepsis patient, you have to know search criteria. We'll discuss it in a short while. So I'll just write the order here. Number 1 is search criteria, and then comes sepsis, and then comes severe sepsis, and then septic shock, and then comes mods. So this is the final stage. So whenever a patient comes, you have to first be able to define this search criteria. What is search? Systemic inflammatory response syndrome. Systemic inflammatory response syndrome. Yeah. So in search criteria we have 6 points to remember. Number 1 is temperature. How much should be the temperature? More than 100.4 degrees Fahrenheit or less than 96.8. So normally what we think is like sepsis is like okay, patient is in sepsis, definitely this patient should be having high temperature. No, it is not like that. Patient may have more than 100.4 or less than 96.8. Number 1. Number 2 is heart rate. Heart rate is more than 90 beats per minute, and then respiratory rate more than 20, and then comes WBC count. WBC count should be less than 4,000 or greater than 12,000. Okay, 1, 2, 3, 4. And then fifth point, this is very important, new altered mental state. This is the point where we don't concentrate. See, patient is in, suppose the patient, the BP will be around 80/40, 80/60. Because of that also patient will be having altered mental state. And then sixth one is blood glucose. Blood glucose should be more than 140 milligrams per deciliter in non-diabetic patients, because in diabetes anyways the sugar will be very high. Okay, so temperature 100.4 or less than 96.8, heart rate more than 90, respiratory rate more than 20, WBC less than 4,000 or more than 12,000, new altered mental state, and sixth one is blood glucose more than 140 milligram per deciliter in non-diabetic patients. So out of these 6 criteria, out of these 6 points, so patient should be having at least 2 or more points or 2 or more criteria to be said like patient is having systemic inflammatory response syndrome. For suppose patient came with heart rate more than 142, like heart rate is 142 and BP 80/60, or temperature is 103.5 degrees Fahrenheit. Suppose the patient is having heart rate of 142 and the temperature is 103.5. So these 2 points, at least 2 or more than 2. So the patient is fitting in SIRS. Okay, and then when do you call sepsis? Sepsis is SIRS plus confirmed or presumed infection. So we call the patient is in sepsis only when the patient is having at least 2 parameters in SIRS criteria, plus it is a confirmed infection or presumed infection. So confirmed infection is like, for example, patient is having some bed sore or a known case of, maybe he have been treated at other hospitals for pneumonia or any other infection, maybe cellulitis. So cellulitis, if you see the cellulitis with fever, it is a confirmed infection. So that is sepsis. And then when do you call it as a severe sepsis? So sepsis we told SIRS plus confirmed and presumed infection. When do you call severe sepsis? Severe sepsis is like sepsis plus organ dysfunction. So we call it as severe sepsis when there is sepsis and organ dysfunction. So what is example of organ dysfunction? So organ dysfunction is like, for example, patient will be having LFT, deranged parameters. This is organ dysfunction. Maybe patient is in pulmonary edema. You can see we generally call it as LRTIs. Lung is affected, and suppose a patient creatinine is high. So patient is in AKI. So kidney is getting damaged. Your liver, lungs, kidneys. So this is called organ damage. Okay. Suppose the patient is having meningitis symptoms. Brain is getting affected. So this is organ dysfunction. So severe sepsis is sepsis plus organ dysfunction. And then what is septic shock? Septic shock is severe sepsis plus refractory hypotension. So what is refractory? So patient is having 103 fever and the BP is 80/60. You have given 1 liter bolus. Now BP increase it to, let us say for suppose 160, and again after some time it will fall down to 80/40. So despite giving fluids, if the patient is not maintaining BP, or if still the patient is in hypotension, so that is called refractory hypotension. So septic shock is like severe sepsis plus refractory hypotension. And then final thing is MODS. MODS is like, when do you call MODS? Multiple organ dysfunction syndrome. So if there are at least 2 organs are getting damaged, 2 organs are involved, or more organs are getting damaged. So for example, LFT is deranged and creatinine is raised. So a patient is in AKI and LFT deranged, so both the organs are getting affected. So we call it as patient is in MODS. Okay. So always number 1 comes SIRS. You have to know the 6 points in systemic inflammatory response syndrome. 6 criteria you have to know. And then comes sepsis. Sepsis is surplus confirmed or presumed infection. And then severe sepsis. Severe sepsis is sepsis plus organ dysfunction. And then septic shock. Septic shock is severe sepsis plus refractory hypotension shock. And then comes MODS. So, whenever we write this provisional diagnosis, we have to be specific whether it is severe sepsis or septic shock. So if you write clearly, then it will be very good. Okay.